Joining us now over Zoom, Dr. Jennifer Dillaha. She's with the Arkansas Department of Health to talk more about the state of COVID-19 in Arkansas. Dr. Dillaha, thanks for joining us.
Well, thank you for having me.
We really appreciate it. I know that this is an important time. Looking at today's case count, more than 2,500 new cases over the weekend. Hospitalizations are up, the deaths are up, ICUs are up, those on ventilators are up. Is it safe to say that we are in that third surge right now?
Yes, we are definitely in a surge right now, and it's very worrisome, particularly with the number of hospitalizations.
What is the current status of Arkansas hospitals? We heard over the weekend Dr. Cam Patterson from UAMS say that the hospital there was full. That's very alarming, I'm sure, to you as well at the Department of Health.
Yes, we're hearing from other hospitals around the state that they are also full. As of today, we had 787 people in the hospital, and we had 79 people admitted, additional numbers in the hospital compared to yesterday. For today, that is the largest one-day increase we have had since the beginning of the pandemic. 79 more people in the hospital today compared to yesterday.
Well, that is just incredibly concerning. So what happens if the hospitals, and you're saying that it's not just UAMS, there are other hospitals across the state at capacity, they're full. What's happening with patients? What's next?
Well, you know, the issue with the hospitals having so many patients is not the physical beds, not the ventilators, but it's the people to staff the beds. And the staff at these hospitals have been going full tilt for months and months and months. So it's very distressing, I'm sure, to them and all of us to see this large increase. So they are having to take steps to address the needs of their patients in ways that they ordinarily wouldn't. They may have to decrease the number of elective surgeries. They may have to prioritize who gets admitted, who stays in the emergency room, and find ways to care for patients when they don't have the hospital bed with staff to put people in.
I don't have much time left, but we're also hearing numbers in terms of the COVID-19 patients at Arkansas Children's Hospital continues to increase. What can you give us? Can you give us a status report on what's happening at Children's Hospital?
Well, we are seeing younger and younger people admitted to the hospital with this new Delta variant. And so they are doing a great job of taking care of their patients, but they're also getting full.
All right, Dr. Jennifer Dillaha, just giving us an update on the state of Arkansas hospitals. A 79 person increase. That's the largest increase of hospitalizations in the day since the pandemic started. Dr. Jennifer Dillaha, thank you for joining us this afternoon. Really appreciate your time, everything you're doing there, along with all of our healthcare professionals.